Hello everybody, welcome to our next edition of Ask the Expert on localinterviews.tv. Today's interview is with Dr. Peter Fodor, an international leader in the field of aesthetic plastic surgery. He's a highly respected professional surgeon, a teacher, and author. So welcome, Dr. Fodor.
Thank you, Eric, and thank you for that nice introduction.
Great. So the question today, Dr. Fodor, is we're trying to figure out how should people go about finding a good surgeon using the internet. So what would you tell somebody asking you that question?
I think those people looking at the internet to find a good surgeon, they have a pretty difficult assignment for themselves. They have to be very diligent in their research because there is a fair amount of false and deceptive marketing and advertising on the internet, including patient testimonials, which can be manipulated. So once patients find 3-4 different surgeons' name whose, let's say, the websites they like and maybe the results they look before and after pictures and they're pleased with those, then I think what they need to do is dig a little further, find out some more about the surgeon's training, find out whether he's board certified or not, whether he has ample experience in the procedure that they are seeking to have performed. None of this, of course, replaces an in-person interview. And to that end, that makes sense. It makes sense at times to see more than one surgeon, have a consultation with more than one doctor, and see who they feel comfortable with, whose office and office staff they like, and where there is a good, for lack of better wording, chemistry between the surgeon and themselves. Not to be ashamed of asking questions. It's okay to say, how many of these procedures have you done? What were some difficulties that you encountered? What have you learned in the last 5 years of doing this procedure? Questions of that sort make all sense, because in our experience, and I do more than 50% redo patients who have been done elsewhere and are not fully satisfied with their procedure, the common statement made by these patients and that they did not do sufficient research before they submitted themselves for surgery with a given surgeon.
Great advice. I think this is right on. So thank you for that. Speaking of doing consultation, what can they expect when they come and visit you at your clinic or whatever else they contact you first?
Well, we offer, first of all, especially for patients from out of town, so they don't have to travel a long distance, an on-Skype consultation. This is a preliminary consultation, does not replace an in-person consultation, but in doing such a consultation, we are able to exclude those patients for whom the procedure is not justifiable for whatever reason, or patients who maybe have unrealistic expectations from the procedure. Once that step is behind somebody, then they can come, even if they travel from a little distance, for in-person consultation. Our offices, to start with, already from the time when somebody makes an appointment, our staff is very accommodating, very knowledgeable, answers all the questions. I think that's important. It's very important for us to make patients extremely comfortable. To that end, our offices have a very soothing light green decor, but none of this is as important as patient safety. And we do have an operating room on our premises, which we're happy to show to patients when they come initially for consultation. That makes them even further relaxed by knowing where the procedure might be taking place. Again, not only the staff is knowledgeable and accommodating, but our consultation is in great detail. We look at patients from an anatomic standpoint, whether there is some kind of complaint they have that indeed we can address with the current techniques and make them aesthetically look better. And then we also look at them from an emotional standpoint, whether they're good candidates or not. So, after the consultation is carried out with myself, then patients are shown other patients before and after pictures for the kind of topic that they're consulting for. And then if all this goes forward, then we set up an examination with another physician who makes sure that they're in good enough health to have anesthesia, in good enough health to have the procedure. And then after that, we walk them step by step to the procedure to make it for them a very pleasant experience. Our patients in general tell us that they have very minimal, if any, pain after surgery. Surgery is trauma. We work a great deal to minimize trauma. The more you minimize the trauma, the less discomfort we have. Our patients, not uncommonly after breast augmentation, for example, can go shopping on the same day. Or patients after facelift, we have them out of bed on this day of surgery. Same thing with body sculpting patients, liposuction, tummy tucks. We have them shower next day, and we have them return to their normal function as quickly as possible. So this kind of approach really secures a happy patient and a happy result.
Well, that's very, very interesting. And one thing, though, that you didn't mention is that you're not just any plastic surgeon. You've got a lot of experience, and you've been even a guest at Entertainment Tonight, if I'm not mistaken. So why don't you tell us a bit more about who Dr. Fodor is?
Well, it's hard to touch your own horn, but I've been president of our national society, which calls the American Society for Aesthetic Plastic Surgery. I have done a number of interviews on national television, also been written up in a lot of ladies' magazines, and partially this had to do with the fact that through my professional career in plastic surgery, I have had the opportunity to contribute with new developments to the field, whether it was body sculpting or facial surgery. We can, for example, endoscopically do facelift with no scars. We can do liposuction, where we not just suction, but we also sculpt. And we can do breast reductions just with liposuction with no scars to speak of, except maybe a 1/8 of an inch length scar in the fold under the breast. So we've been trying to contribute on the cutting edge of the specialty. It has been a very rewarding profession for me, because creating results that patients are very happy with, that's rewarding for the patients, but they're equally rewarding to myself.
You're modest, you. So thank you very much for that. And my next question, I don't think is even necessary, because why would anybody need an incentive to come and see you? But let me go there anyway. So what do you offer to first-time comers? Do you offer any incentives to come and visit you?
We're happy to see patients. We're happy to see patients with no consultation fee. And if we don't charge them consultation fee first time, then we don't charge them if they come back 4 more times and ask more questions. This is true for any consultation. We also offer, for one area of the face, botox injection at our own cost, which is about half of the regular fee. So those are the incentives we're happy to offer.
That's great. Thank you very much, Dr. Fodor. So that's basically it for today. So thank you very much, Dr. Fodor, for taking the time to do this with us. So again, a huge thank you to you.
Thank you, Eric. I enjoyed it.
Perfect. So that's it, everybody, for this edition of Ask the Expert. Today's expert was Dr. Fodor, Peter Fodor, a plastic surgeon, operates in Los Angeles, but also in Aspen, Colorado. So if you want to have a free consultation with Dr. Fodor or 50% off Botox treatment, just go ahead and contact them. You can see Dr. Fodor's website, which I believe is Peter Fodor MD, right? Just give me
it's PB Fodor, peterfodormd.com.
There it is, so Peter Fodor MD. You can see it right now on the screen. I just switched back to you. Or contact him at 310-203-9818 to book an appointment with Dr. Fodor, whether it's through Skype or live. So once again, everybody, thank you very much for being here. So see you later. Bye-bye.
Thank you.